I'm so excited for this. Today, I'm honored to have Dr. Laura Buchanan. Dr. Buchanan is a board certified family medicine physician with a profound passion for utilizing lifestyle modification as the primary approach to care. Her journey in medicine includes completing her family medicine residency at Wake Forest in 2022, where she was distinguished as a valedictorian. Prior to that, she achieved summa cum laude honors for her Bachelor's of Science in Biomedical Sciences from the University of South Florida. Dr. Buchanan continued her academic excellence at the University of Florida College of Medicine. Her dedication to metabolic health has positioned her as a founding member of the Society of Metabolic Health Practitioners, where she currently serves as the board of directors alongside esteemed professionals such as Doug Reynolds, Marco Cuzella, Miriam Kalayaman, Robert C. Wise, Eric Westman, and of course, Dr. Tro. I'm so excited for this. I'm here with Dr. Laura. Dr. Laura, welcome to the show.
Thank you so much for having me. And I do feel so lucky to be working with that group of individuals. They're the best mentors you could imagine.
Yeah, you know what? When I heard about your story, Dr. Laura, it's just fascinating because usually it's somebody going through medical school after years in practice, then suffering a chronic disease themselves, conventional treatment doesn't work, then low carb community, that then the epiphany, right? But I'd love to hear about your journey. How you're a young medical doctor yourself, already practicing lifestyle interventions. That's really unheard of, as far as where I can see it. But let's go talk about your story. How did a young medical doctor like yourself, find her way into focusing on lifestyle rather than just the conventional methods of, treating these conditions?
Yeah, absolutely. So I grew up loving playing sports through undergrad. I played soccer and I was what I thought I was doing, eating a healthy diet, although it was lower in fat. It was probably more close to a standard American diet, but I really was trying to be lower fat. I didn't eat red meat for about a decade. And while playing soccer for about 5 days a week, my A1C had gotten into the pre-diabetes range at
Mm-hmm.
5.7. And during that time, I still was very passionate about physical activity and exercise, but I also was seeing in my own family members people that I loved, some of them aging very well, and then others unfortunately having chronic conditions with very serious medical conditions that were having complications. And the difference in those loved ones was just their lifestyle. It was someone being physically active as well as eating home cooked meals and not eating ultra processed foods and sweets all the time. And whereas the individuals who were having complications, having diabetes with complications, it was eating the standard American diet, processed foods, less active. And so I really saw the power of lifestyle just watching people I care about age. And so I knew I wanted to do something medical, work with people, and realized it in family medicine. So going into medical school, I said, family medicine, I can work people that are from
Mm-hmm.
baby to the grave, and that's how I can hopefully help the most people. I didn't really realize it was going to be low carb that was going to be what I became passionate about and could really provide so much benefit to people until towards the end of medical school. We had partly way through medical school, there was a 2 week nutrition intensive,
Mm-hmm.
and it was really underwhelming. You learn the classic vitamin deficiencies you have to know, but you didn't learn any practical information about how can I use use what people are eating to help actually prevent chronic
Mm-hmm.
diseases, to put chronic diseases
Mm-hmm.
into remission. And so at the end of that course, it was just very frustrating. And I started doing a lot of my own research. And I came across Nina Teichel's The Big Fat
Mm.
Surprise, Jason Fung's Obesity Code. I found the Low Carb MD podcast when it first started. And and then it was like my mind was just boggled by
Mm-hmm.
everything. And it was so exciting though to hear the successes that these other doctors were having. I started watching Eric Westman's videos on YouTube as well, and they were really changing their patients' lives, improving them, getting them off of medications. And with Nina Teichel's is The Big Fat Surprise, the nutrition information I'd just been taught in that 2 week elective but most of it was, or part of it at least, was
Mm.
inaccurate or wrong, or was the studies are misinterpreted. And so between that and my brothers telling me, I should be eating red meat, it is good for you, and I'm wrong on that front. I said, okay, I'll look into the research. I realized, yeah, I'm definitely wrong. And now I eat red meat pretty much on a daily basis, and I feel fantastic, I think, for doing that. And so, fast forward through medical school and learning all of that from listening to the podcast and reading the books. Come residency, I just decided from the get go that I was going to practice low carb.
Mm. And this was in your 20s, right?
Yeah.
Wow.
Yep.
You're
Yes.
an island on your
Mhm.
own because that doesn't happen at that young of an age, and that collect collective experiences that you have at such a young age. You have a lot to you know you have you have you've impacted a lot of lives already at such a young age, and I'm so happy for you, and I'm so happy for the community because you have such energy and passion about this. I could just tell that you're gonna make waves in this industry. Like you're gonna you're gonna change
Yeah.
people's lives.
Thank you. I really hope to, and I think we're already seeing some of the benefit through
Hmm.
residency. I was able to actually, I gave a lecture on therapeutic carbohydrate reduction on the guidelines published by the Society of Metabolic Health
Hmm.
Practitioners. And I had other faculty members and residents actually show interest in low carb and helping people, and and actually some of them started
Hmm.
implementing it for their patients with
Hmm.
diabetes. And so to kind of see that already change just in
Yeah.
residency was
Hmm.
very exciting.
Let's talk about residency, though. We talk about it being successful now, but it wasn't always that way, right? You said there was a little bit of pushback, especially in that front when you're starting from the conventional medicine approach perspective, right? You mentioned creating a nutrition curriculum during residency as your elective. Was looking into
Yeah,
one of your interviews, you addressing topics like how low carb and the background for nutrition, right? Given that resistance you've encountered in your residency, could you like share more about your experience and how you navigated pushback? Additionally, you mentioned also that the hope for expanding the curriculum to medical schools too. Talk a little bit about that, and how did that,
yeah,
form your practice? Yeah.
yeah, absolutely. So the initially there was some pushback, but the faculty at Wake Forest were amazing, and they were really open. They're open to learning from their residents, and as well as providing wonderful education. But so, as this is the perfect example, but I had a patient come in with an A1C that was over 13. It was a brand new diagnosis. Conventional standard medicine says put that patient on insulin. Their A1C is over 10,
Mm.
and then work on lifestyle modifications with that as well. And I talked to the patient and said, hey, let's put a continuous glucose monitor. We'll check some labs, make sure it's safe, that you're not on insulin. And if you want to trial the ketogenic diet, I think we can avoid medications. And he was
Hmm.
all on board. And in 1 month,
Wow.
his CGM was showing sugars that were just in the
Mm.
pre-diabetes range. So basically an A1C that would have been around
Mm.
6.0, up from above 13. Now, when initially you have to go precept, meaning you go tell the attending doctor about the patient and your plan for their care. And so when I told the doctor who was watching my care, I'm not planning on starting any medicine. We're going to use a continuous glucose monitor. We're going to use the ketogenic diet. I definitely, there's a little bit of resistance and concern,
Mm.
but I explained my reasoning, that I have seen this before, that we're going to be very safe. We won't let his sugars ride extremely high for several days. If we need to go to medicine, we will, but let's give this
Mm.
lifestyle a chance, and we'll closely monitor. And then you see the results, and you can't argue with those results. That's
Mm.
incredible. And so that's where I think I started actually having some of the faculty kind of turn around and even be more open to
Mhm.
using low carb in their practice. So
Yeah.
that was in the actual clinic setting was really cool to see, and was positive. In
Yeah.
the hospital setting, I didn't make as much progress, or unfortunately for patients. The one of the ones that really sticks out is a 12-year-old who was admitted to the hospital for a new diagnosis of type 2 diabetes, whose A1C was over 12. And for breakfast, he had pancakes and syrup. And that morning when I came into the hospital to work, he had to get a lot of extra insulin because, not surprisingly, he with pancakes and syrup, his sugars
Mm-hmm.
were really high. And so during our rounding session with the pediatric endocrinologist, I said, "Hey, I'd like to put this kid on a low carbohydrate diet." And the attending looked at me and said, "Well, what are you going to feed him?" And I said, "Fat and
Hmm.
protein." And he said, "Well, if you're giving him all this fat, then you're going to end up causing a heart attack in him." And I was like, "Well, I mean, if you're concerned about that, we can use a higher protein diet, go a little bit lower fat." He's like, and then he said, "So you're going to kill his
Mm.
kidneys?" And like, respectfully, I don't think there's actually a lot of data that shows in someone with healthy kidney function that a higher protein diet is harmful. And the data now that we have used to reference saying a higher fat diet is going to increase risk for heart disease is actually not very good data at all. And I haven't seen anything convincing that that's a true statement. But if you are aware of studies, I would love to see them. Please send them to me. And we went back and forth a little bit, and it was kind of this awkward silence from all the other residents in the room as me and the attending had this discussion. But in the end, he's the attending, and he said, "Nope, keep it on him the diet that he's eating right now, and just cover his carbohydrate intake with insulin."
Mm.
And so, yeah, that is definitely not a victory. And hopefully, someone can find that child out there and teach him at some point that just eating whatever carbohydrates you want and covering
Mm-hmm.
that with insulin is really unhealthy, and that is what leads to these terrible complications that we see with diabetes. Right now in the United States, every 3.5 minutes,
Mm.
there's an amputation due to
So
diabetes. And
So, Dr. Lara,
yeah,
they're saying you can't feed them protein, you can't feed them fat. Then all you can feed them is carbohydrates, and which is so funny to me, right? What are they not? Okay,
yeah,
I'm not a an expert in any capacity in in this field, but isn't that what are they not seeing? I mean, if you can't feed them protein and fat, then there's only carbohydrates to feed the kid.
yeah. I mean, I think that's an extreme example from someone, but you do get that kind of pushback about the concerns of the high protein in the kidneys. And there's studies previously that were not really great studies, but that showed potentially the higher protein could impair kidney function. Just like there's some data that a higher
Yeah,
fat diet could increase your cholesterol, which maybe that increase in cholesterol could increase your risk for heart disease. But they're making conclusions and making assumptions that are just not true statements. And I highly recommend you go read Nina Teicholz's book, The Big Fat Surprise, and she will analyze and really go in depth about
yeah,
why those assumptions and those studies actually don't back those concerns up, which is where that doctor was coming from. He was coming from, that's what I was taught in medical school, saturated fat is going to
yeah,
increase your LDL, it's going to lead to increased heart attack risk. And so that's what he was just spouting and
yeah.
saying, even though he had not reviewed those studies
Yeah.
himself,
So he
clearly.
was just going by his training and what he knows, and not based on experience. I always talk about, and I know it may seem harsh when I talk about medical doctors this way, practicing the conventional way, is that I've never, those doctors have never had a patient come back to them say, "Hey, I cured my type 2 diabetes, I've reversed my chronic disease." They've never probably heard that from anyone, right? And as a coach, for me, I've heard that multiple times when I help people, right? But these doctors that are practicing conventional way, they've never heard that in their life, that a patient ever reversed chronic illness, because they don't expect it to. They don't expect the patient to reverse chronic illness. They expect you to be on
Yeah.
metformin, be on a maintenance, so that you can have pancakes, right? Because essentially you can't ask a patient to change their lifestyle, because they don't. They maybe they don't expect them to. Is that a fair statement?
I have seen that before where I've brought up to doctors like, hey, we could reverse their diabetes if we put them on a ketogenic diet. And the one of the pushbacks that was common was, well, they can't
Right.
sustain that. And why can't the patient sustain that? Is it because we are not providing them the good support they need to
Hmm.
sustain that? Because in that case, that's our fault that we can't provide them the support they need to
Hmm.
maintain that lifestyle. And if so, we need to be doing
Hmm.
better. And I think that's one of the things I love working with Tro and at our practice is we do have really close follow up. We have a messaging system where you can basically text with us and we get back to you that day. And so that's the kind of, I think, support that some people need to really help maintain those lifestyle changes because it is hard to do that, especially in today's food environment where you have food being pushed on you, advertised at you every single place you
Hmm.
go. But I think that is a pushback of why not to give people the
Yeah.
option of it is because they can't sustain it. Is more what's inside themselves. They feel like they could not sustain that lifestyle, so therefore their patient can't do it either.
Dr. Laura, if they are just aware of what this diet is causing people, we've been diagnosing, you said, a type 2 diabetic, a 12-year-old type 2 diabetic, right? We're diagnosing younger and younger people. And
Yeah,
if they just know that impact of, because they have the power, like medical doctors have the power to change the landscape, right? If enough medical doctors just, you know, get on board with this, right? But then there's the medical system that, they're training, like there's ego involved in there too, right? Because they're trained for years, uh you know training in the conventional way, and
yeah,
it's just so confusing for a lot of people because my mom and my dad, they're both diabetics, right? And I know what, when they come out of the office, they're more confused than ever, right? They went on this diet for 7 days, only eating veggies, and it didn't take long for them to go back to their old diet, right? Because it wasn't sustainable, right? And that tells me that
yeah,
there's really, they're not giving them any options, right? I mean, for me, I'm doing this because I want people to know and for them to have an option, right? So you did say you've, in your residency, you use continuous glucose monitors, and I'm so curious about that. And you saw big improvements with
yeah,
A1C, physical symptoms, and even you talked about food addiction symptoms, right? What was the study, and how
yeah.
was that conducted?
Yeah, absolutely. Yeah. So that was a really fun, big project during residency. It was in the group medical visit setting. So we had two different cohorts of about 7 or 8 people with type 2 diabetes, and we gave them continuous glucose monitors and then provided them education about how their lifestyle
Mhm.
impacted their blood sugars. And then they actually would lead the discussions and we would share their glucose graphs on the screen and then talk about, if you ate something and your sugar went way up, what's an alternative food that we could use to help bring that sugar down? And with the IRB, basically the research, we weren't allowed to tell people to go on a ketogenic diet, but we just said with the CGM, try to bring that line closer to a flatter line and make the lifestyle changes for that. And they did great. They improved their A1C. They improved a many physical symptoms: headaches, belly aches, stomach pains, joint aches, things like that, fatigue, anxiety, depression. These things got better in addition to food addiction symptoms. And 6 out of the 6 individuals who did have significant food addiction symptoms, all of them went to no food addiction symptoms by the end of the 14
Mm.
weeks. And this was just by purely working to make that glucose line flatter, not even telling them to go on a ketogenic diet. And so I think it's just such a powerful tool, and that, like, I think anyone in the world should have access to one, but especially if you have insulin resistance, prediabetes, type 2 diabetes, then you should really be using a continuous glucose
Mhm.
monitor to help figure out how your lifestyle, what you're eating, your sleep, your stress, all those things are playing
Mhm.
a role impacting your sugar
And
levels.
that's amazing. Maybe I'll get one for my mom. How did that contribute to your understanding now of like health in general or metabolic health? Like, yeah.
Yeah, I mean, so when I actually, especially because in residency, I had not learned as much about food addiction. This was something I was just barely starting to learn from Dr. Tro and some other people I was doing research outside of residency on. But when we gave the individuals, it's called the Yale Food Addiction Scale, I had, I really didn't know if it was going to be different from their baseline to the end of the study. I was just curious, is this going to have an impact? And just by changing, getting that glucose, the sugar on a more stable rather than having all the variability with carbohydrates. And so seeing the power that just that simple intervention could do in improving the not only the physical symptoms but the food addiction symptoms, I think it was just really eye-opening to me.
Hmm.
And and you see those results and even I think better results oftentimes for people when they go all the way on a ketogenic diet. And so it's just all of the excitement and seeing patients
Mm.
get better, it all just gives me fuel to keep
Mm.
on going and to try to do more research. And that's now working with Tro. We're trying to do more research to build the massive knowledge and get it out there so more doctors
Yeah.
at younger ages can actually start doing this rather than, like you said, oftentimes waiting until they have
Yeah.
their own ailments, fixing it with low carb, and then using low carb.
And this is such satisfying work that you're doing. And, at such a young age, like I said, you are already changing people's lives, right? At such a young age. And I'm really happy for people who will come across you because you have, you will see you're at the forefront of this, and you have so much more to do, right? But the best thing is you're so young, right? You're so young, and it may be an uphill
Yeah,
battle for now, but for those people who are ready to make a change, there's hope because there are clinics like Dr. Tro's and your services that really will help people reverse chronic illness. For some people, they don't know this, stuff, they don't know that they can reverse chronic illness, and their doctor may say, hey, you can't go on on a ketogenic diet, it might cause a heart attack or whatnot. And those people who were failed by the conventional way will look for an alternative way, which is, they'll find services like yours, and it was just a win-win for them as long as they're open for that change. And yeah.
yeah, yeah. And I think, what you said about other doctors finding this or saying like people going to their doctor saying, hey, I want to try a ketogenic diet, but they're then being told it might cause a heart attack. This is why we need to get the education actually in medical schools or residencies so people across the board know that that's actually not a true statement. And that's what really excites me about what the nutrition elective I created with help from Matt Calkins, my husband, who's also in family medicine, and Aaron Sainer, who's now a faculty member, doctor over at Wake Forest, who's also working on this nutrition elective that will have low carb education. And the exciting thing about this is if we can get it implemented in our program and people like it and enjoy it, then maybe we can spread it to the internal medicine residents, the medical school here, and then from there actually continue to expand it. And right now, during when I was a resident there, one person took the course, enjoyed it, and thought that they were able to implement some low carb education for their patients. It is now set up where two other residents have gone through this year, going through that nutrition elective. So if we can keep getting positive feedback and more residents can go through it, this is how, from a grounds up, we start people earlier and hopefully prevent that burnout,
Hmm.
fix yourself, typical
You're
way.
literally changing lives here. I don't know if you're realizing that you're obviously you are for sure because it is so much satisfying work for you and it keeps you going. But in my
Yeah.
perspective, you are changing lives, you are saving lives. And if I can just change more minds that we can open people's heart about this, we can change a lot more people's life.
Yeah.
Maybe your approach when you did your study at your residency, that project that you did, your approach is you know so direct, but also it's easy to understand the way that you explain that to that patient, how he can uh, reverse his type 2 diabetes by just following your guideline. It was so easy to follow, it was so easy to understand. I think just if we can just continue on with that, and how use language, right, to make people understand without scaring them away, right? Because it's a huge
Yeah.
part of it, right?
Yeah. I would encourage people to go to the
Yeah.
smhp.org. And on the website, there's
Hmm.
resources for patients, for practitioners that are just single
Yeah.
page documents. That it's, if you were to eat basically the foods on this page, you will likely go into
Yeah.
ketosis and greatly improve your metabolic health. And there's also, you could take those to your doctor, and there's one on
Yeah.
insulin resistance, one on the evidence that shows how this is not only safe but extremely effective. It's a single page with data from Verta Health, Dr. Unwin, Dr. Tro, and you can take that to your doctor and say, "Hey, look
Mm.
at what these studies have shown and how effective this is. Do you think I can try that for my
Mm.
diabetes or for my hypertension,
Yeah.
XYZ?" And then they have the data in front of them, and maybe that'll spark an interest to for them to learn about it,
Mm.
and that could be another, I think, helpful way. So people bringing it to their
Mm.
doctors and making them curious.
Mm. Yeah. At least make them curious, right? So yeah,
Yeah.
I went to the SMHP resource hub for patients, and for literally everybody who is interested in learning about low carb. It's easy to understand it because I
Yeah.
actually printed a couple and sent it to my mom and my sisters. So yeah.
Nice.
Could you, because it's so easy to understand. I mean, with insulin resistance, you know how that can be complicated, but with the diagram and how it's placed, it's so easy to understand for somebody who is actually dealing with it. Because I always try to explain it to my mom and how insulin resistance works, but when you have it in front of you with diagrams, it's so much easier to remember, right? Could you share some of
Yeah.
these resources that they can find there too?
Yeah. Some other
Yeah, yeah. The
ones on
key,
the
some
website.
key resources that they can find. Maybe learning about insulin
Yeah.
resistance. What else can they learn on that?
Yeah, absolutely. So there is a list
Mhm.
of practitioners. So if you are in an area where you can't find someone to help you with a low carb lifestyle, then there's a list of health coaches, doctors, PAs, and different specialties. There's also a video now and a PowerPoint. So if you are working in a practice and you want to try to bring a metabolic health clinic to your practice, and maybe it's a group of doctors or nurse practitioners, PAs, you could actually take that PowerPoint to your administration and give it as a presentation that kind of shows the benefits of metabolic health
Mhm.
and what you could bring to the clinic. And I think that's a really helpful resource. The other thing that's very exciting, and it's more in the works, but we're working on getting educational resources on doing research, videos, education, and even might have research mentors. So if people are out in their own clinics or maybe residents, medical students, and they're passionate about this stuff but need help with research, then they could come to the SMHP for that. And we've actually now have our own official journal, the Journal of Metabolic Health, which is going to be great because we are seeing case reports, case series, larger trials now being done on the benefits of a ketogenic diet for so many health conditions, mental
Mhm.
illness,
Mhm.
um, cancer, reflux disease, IBS. There's been case reports even on things like Huntington's
Mhm.
disease, which is a very serious genetic disease, and with wonderful benefits. So this can be an outlet, a journal that shows all of the kind of in one
Mhm.
area, hopefully, a lot of data research showing benefits from therapeutic carbohydrate reduction or low carb or ketogenic
Dr.
diet.
Laura, I want to ask you,
And so that
when
is
you say that the ketogenic diet or low carb diet can help all of these symptoms, right? All of these conditions, what do you say to somebody
yeah,
who says, "Hey, how can the ketogenic diet do all of that?" What do you say?
that is, it's really complicated, but there's several different ways. The ketones themselves actually act on turning on and off certain genes, and they decrease inflammation in the body. If you're They've actually shown in patients, in someone who had Crohn's disease and had a very leaky gut with lots of proteins and things being able to go through, that the ketogenic diet was able to close the leaky gut, which you can imagine is going to fix a lot of medical conditions. There's been impacts and shown benefits through altering the gut microbiome. The ketones themselves act as a fuel source. So we've seen benefits in people's
Mm,
cognition, even in mild cognitive impairment, and in individuals with Alzheimer's having some benefit in
mm,
memory. And that's the ketones actually act as an alternative fuel source
mm,
to sugar. And with Alzheimer's
mm,
as an example, the brain doesn't utilize sugar as well, and so now it has an alternative source that it can actually
mm.
access again. So
Yeah,
those are the ketones.
yeah.
Yeah, it gets complicated.
So I've heard that you'll be giving a free 4-week course on diabetes through the Dr. Tro app for Diabetes Awareness Month. What are your goals for this course and how can people participate?
Yeah, so actually that was the month of November, and we recorded the course, and it was great. It was a ton of fun. I had a lot of people join who were people who were members in our community, as well as people who were just joining to learn more about diabetes during that month, since it was
Mhm.
free on at that
Okay.
time. We covered all things diabetes. So what is diabetes, what it means
Mhm.
when you're diagnosed, complications that can arise from it, why medications are not the answer and are not the way to kind of reverse actually your diabetes.
Mhm.
Then some really kind of practical stuff of how do you implement low carb, how do you read nutrition labels, looking out for hidden sugars that are in so many things now, how to navigate social events, the holidays, which this time of year is really tough.
Right.
And that, yeah, it is hard. So all of that was covered, and it was a lot of fun. We do still have that available in the app. It's no longer free, so if you become a premium app member, you have access to that and all of our other courses and their Zoom recordings. And so we have a course on continuous glucose monitors, cardiovascular disease, and calcium scans, and a walkthrough basically how to start a low carb lifestyle, and a lot of other information as well, different lifestyle levers you can pull. So I encourage people, if they would like to join the app, definitely do so. You can also just be a part of the community and join in the community chat without paying for the monthly premium access, and just to have that extra support, especially if maybe you don't have a lot of support in your life or other people living
Mhm.
that way, it can be helpful to be in that community there.
Mhm.
um, so, and in January we're going to be starting our intro to low carb course.
Awesome. There's a lot of opportunities here, guys. If you guys want to check out the Dr. Tro app, what are some of the most common questions that people ask you guys about low carb and before they start?
Yeah, so oftentimes there's the red meat and colon cancer
Hmm.
concern,
Hmm.
and that one I typically go through, but kind of briefly, a lot of these studies that show some complication or some issue with cardiovascular health and low carb ketogenic diets, what they will do is give someone a food frequency questionnaire or a 24-hour food recall, meaning say, what did you eat in the last 24 hours? Or with the questionnaires, they'll say in the past year, what did you eat? And then there's 100 questions. And then they just follow that group of people for 12 years or 11 years, pick the time frame, and say what happened to them during that point. And then they look for some association between what that single questionnaire or that single 24-hour food recall, and 12 years later they try to blame that medical condition from that one point in time.
Mm.
And so you can imagine that is just really terrible data up front. People will change their dietary habits all of the time. Additionally, they're not very accurate. They've done studies to see how accurate these questionnaires are, and people just aren't good at remembering what they ate for the past year. I can, it's hard even for me who eats a very consistent diet. I'd still not be very
Mhm.
precise on those. And the other really big issue is if it's asking you about eating hamburger patties. When I eat a hamburger patty, I am eating something I cooked at home with maybe broccoli on the side, but otherwise I'm just having some hamburger patty with some salt, usually,
Mhm.
maybe some cheese on top, nothing else. But on the questionnaire, there's nowhere to put that. So that will be the same as someone who goes to McDonald's
Right.
and eats a hamburger patty and maybe a French fry and a large Coke and maybe a
Mm.
milkshake. So
Yeah.
it's just not even close to comparable. But the data, those questionnaires can't parse that out.
Mm.
So I kind of explain that process to kind of ease their fears. Then the other one, often people hear about the keto flu and, worried about that happening, especially if you are eating a lot of sugar, a lot of processed foods, it can happen more quickly. But really, that is your body adapting. But it's oftentimes, really, I should say, your electrolytes and your hydration. And so your
Mhm.
body, your insulin levels are going to drop. Your kidneys are going to start peeing out more water and electrolytes because your insulin is dropping, which is a good thing. And so you just need to have extra water, extra electrolytes. So that's oftentimes just helping people navigate that. And and then just the practical, what should I eat,
Mm.
and how many carbohydrates should I have per day? Total versus net carb is a big question. We like to focus on total carbohydrate count because there are so many packaged foods now that say keto friendly, low carb,
Yeah.
zero net carbs, or one net carb,
Yeah.
but really they're not health foods. They do increase your blood sugar. Your body can
Mhm.
process those carbohydrates and those fibers that are added.
Mhm.
So we just stick with total carbohydrates.
Yeah, they can slap that keto label on anything nowadays, right? And you won't think that those products will spike your blood sugar or insulin levels. It will, right? That's why you gotta have those CGMs handy,
Yeah, exactly.
right?
The CGM does not lie.
Yeah. Yeah, as you're right.
Yeah,
Such a great tool, and you brought up such a great point where just make sure you don't have to even mention keto or diet. Just have this baseline. Don't go over it, and see where the magic happens. Right? You gotta have that
yeah,
CGM.
yep. Huge
Yeah.
fan.
Well, thank you so much, Dr. Laura, for coming on and sharing your story here with us today. I really appreciate your insights, and your story is such inspiration for somebody who's so young but already making waves in the community. Is such, gives hope to a lot of people. So thank you so much.
Yeah, thank you. It's been my pleasure, and we're doing a lot of telemedicine now and accepting patients in almost all 50 states. So if you feel like you've got want to improve your metabolic health, that is what I enjoy doing. So feel
Mhm.
free to look us up, drtro.com.
Yeah, just a sample of what you can get, guys. So make sure to download that app, Dr. Tro app. It will be linked down in the description box below. And to connect to Dr. Laura, everything's down in the description box below as well. All right, Dr. Laura, I appreciate you coming on and sharing your story here with us.
My pleasure. Thank you so
All
much.
right, bye bye.